Hi, everyone. My name is Itzel Lara Castillo.
My name is Christian Standifer.
And my name is Zachary Liberati, and today we will be presenting over depression under the mentorship of Dr. Elizabeth Washir. Depression is a very major public health concern. It affects 1 in 3 people. That's not only in the United States, but worldwide. Depression can look all types of ways. It affects your mental health specifically, but where bad mental health can eventually lead to your physical health and the deterioration of your body. Um, Mental health is not, depression is not specific to age, sex, race, or any other identifying factors. It can come in all shapes and forms, and it can affect anyone. That's why it is very important that we express the concern of depression so we can avoid the bad of it, which is suicide. The worst thing that can possibly happen with the diagnosis of depression. This is very concerning because a lot of people are committing suicide, especially with everything going on in the world today.
So, depression is a mood disorder characterized by the persistent feelings of sadness, hopelessness, and often a loss of interest in daily activities. Um, it's often accompanied by physical symptoms like overwhelming thoughts and emotions, and just an overall um, well-being being affected. There are a couple risk factors such as age, sex, meaning gender, living habits of the person suffering of depression, and the individual's background. Unfortunately, these are risk factors, but they are not exact causes for depression. There's multiple contributing factors aside from the previously mentioned ones, such as genetics, the person's specific brain chemistry, um, trauma in the person's life, such as deaths in the family, abuse, whether it's mental, physical, or sexual in nature. Oftentimes, depression can be attributed to other medical diagnoses, such as cancer, eating disorders, or unmanaged pain. Determinants are often overlooked, such as medications. There's medications such as birth control, anticonvulsants, which help with epilepsy, migraine medications, and cardiovascular medications, um, to name a few that are often overlooked as risk factors. There's often direct impacts that may result from changes in the central nervous system. Um, on the other hand, they could have an indirect effect, which results in drowsiness, frustration, confusion, or in the worst cases, a depressive or manic episode. It's challenging to determine whether a drug or any other factor contributes to a person's depression. However, according to an article published by the NIH, patients with medical conditions are far more likely than those who aren't taking medications to experience depression. Approximately between 10 and 20% of individuals with cancer, diabetes, acute heart failure, or renal failure also experience major depressive disorder.
So we wanted to kind of get some numbers to see how this how many people this really affects. So we want to start out by giving the prevalence rate, which is going to be the old and the new cases divided by the total population. So we did that on a national and a state level. We have 19.5% of people have or have or just started having depression, and then 24.4% in the state. And then we also wanted to see if how many people were dying with the depression rate. So that's going to be our mortality rates. And we have for a national level of 14.2% and on a state level 14.1%. And that's going to be per 100,000 people.
Next, we will be talking about the intervention opportunities and ways that you can help manage depression. One of the specific ways that you can help manage depression is your eating habits. Research has shown that your eating habits are they go hand in hand with depression. The more fast food, junky food that you do eat, the more likely you are to be depressed. So hopefully by replacing these unhealthy food with more cleaner and nutritious food, it would help produce more people with less depression rates. Another intervention opportunity is therapy. Cognitive therapy has shown that there is a lot of positive that comes out of it. It's shown signs of success. With cognitive therapy, they find the root of the problem through your behaviors. So, for example, smoking, drinking, you get to the root of the problem by identifying these behaviors and then applying changes to them. Also, creating screenings and health services that also do like screening, evaluation, and safety strategies, as well as ongoing support that can help the quality of mental health amongst people. The specific target population that we will be focusing on is college and young adults. Factors that influence college and young adults is biological and genetic factors, psychological factors, and social and cultural factors. When you become a young adult, you're faced with a lot of big decisions and substance abuse and many different things that are new to you at that age. So it's a very vulnerable time for individuals, and they're more likely to experience depression and anxiety.
Especially with college students, just because we are transitioning from living with our parents for 18 or 20 years, and then now we're going to be more independent with our living situation. So that's okay. How am I going to pay my bills, or how am I going to make sure that my tuition gets paid? So these are some of the questions that us as college students have to answer. And of course, we have, outside support and things like that, but only the college students know what they're facing on a day-to-day basis and how that just kind of like implements some decision making that has to be determined.
Next, we will be talking about the implications. So, the acknowledgement of depression is very important as it can help millions of people who are suffering. Unfortunately, it is a very common mental health issue. Um, like previously stated, it is very common within students our age or college students. Mental health professionals should be the main advocate for, as it is one of the major diseases that are studied. There are many people who see it on a day-to-day basis, such as teachers, counselors, friends, and parents. Um, it is always good to be on the lookout for these issues, and especially if you know of resources to be able to direct students in that direction. There's also many ways to educate people on depression, such as health fairs, brochures, and screenings. Depression can decrease in a high fashion if people are able to recognize, get diagnosed, and get treatment. But it must all start with recognition. Having said that, education strategies are important to try and address the issue of depression, since public awareness is important to help decrease the stigma around mental health, specifically depression. Like previously stated before, cognitive behavioral therapy is one of the first types of psychotherapy, and it has the most research behind it. Therefore, it has been proven to work in instances where depression is very severe, and is often one of the first resources that people are directed towards before having to admit them into mental health facilities to get further help. All in all, depression can and is a serious issue that contributes to the lives of everyday people. It is something that can happen in an instant and can take years to be recognized and treated. And having said that, there are a lot of people that go without treatment. Therefore, public health professionals should target depression and try to decrease the incidence rates of this mental disease. Again, if not treated for depression, it can lead to a lot of really bad stuff happening to the person dealing with it, such as suicidal ideations, or in the worst case, suicide.
If you are feeling some symptoms of depression, There are multiple hotlines that you are able to call, especially the suicide hotline. If you ever feel the idea of suicide ideations, we can also look at the NIMH, the National Institution of Mental Health, as well as the CDC for more facts about depression. And we just want to say thank you for watching our presentation over depression. We hope that you are able to learn something new and also be able to kind of see if you can kind of do like a self-check for your mental health. Thank you all, and have a great rest of your day.